COVID-19. A 20-year-old man who's received 3 prior vaccinations and had COVID 2 times in the past is still advised to get the fall COVID-19 booster. This is really a very aggressive and outlier position that's not on par with peer nations and appears to be, in my opinion, deeply problematic. It's medically problematic. There are many levels of problems here. Let's try to unpack some of that. Let's talk about Ashish Jha and some of the things he's saying on Good Morning America. Let's get into it. So what's the first thing I want to say? The first thing I want to say is that it was not guaranteed that we need an annual COVID-19 shot. In fact, for some people, they may need it more than annually. I mean, they may benefit from something more than annually. For other people, it's very likely they don't need any additional doses. Paul Offit puts it well in a Science magazine article this week where he says the real question is, do you have a further reduction in severe disease or hospitalization from additional doses? And the answer is we don't know that for any ages. Even our European colleagues who are just giving it to 65 and up, they don't really have evidence that the 67-year-old person who gets this booster has a further reduction in severe disease or hospitalization from getting that booster. There is no real population level reduction in transmission because we know the COVID-19 shots, after at least a few months, have absolutely no effect on transmission. They can't possibly have an effect on transmission because they have no effect on symptomatic SARS-CoV-2 acquisition. We don't have robust evidence that they even have a short-term transient effect on transmission. We have some short-term effect on symptomatic SARS-CoV-2 from prior boosters. We have no data for the forthcoming fall booster, but we really haven't studied very rigorously transmission. We may know if you have enough virus that can lead to a PCR positive result or a antigen positive result or even viral culture positivity, but we don't really have gold standard evidence about transmission, the act of spreading the virus. Let's set all that aside. I think it's generally well agreed upon that these vaccines do not halt transmission. They don't really slow transmission. I think the idea that if you vaccinate some pockets of very wealthy nations with an annual COVID-19 booster, that you will slow transmission across the globe as COVID-19 sweeps around the globe for the next 10,000 years, the idea that this kind of vaccination strategy will make any effect in the broader scheme is thinking that you're slowing a forest fire by dumping a glass of water out on your lawn before you evacuate. It's pretty stupid, and I think that's a stupid thing to think. The next thing. The White House did not have to agree to Pfizer and Moderna's plan to have these boosters in perpetuity in the absence of randomized control trial data. We could easily have randomized control trials running as we speak, powered for severe disease and hospitalization. They can be registry-based randomized trials, open-ended sample size randomized trials. They can just keep enrolling people at different ages, powered to detect interactions, i.e. maybe it works in older age groups, but not at younger age groups. The moment those results are positive, we can debut the practice widely. We can have randomized implementation. We did not have to have this model where the company tells us what variants we should worry about and the company makes a vaccine against those variants and we just give it full approval and recommend it widely. We didn't have to have that model. We could have had an evidence generation model, which is what many people wanted. And in fact, what Peter Marks himself at FDA suggested would happen in his JAMA viewpoint from earlier this year. Normally, you want drug regulators who are not political appointees making these decisions. We don't have that in this situation. We have the White House puppeting the CDC and FDA to make decisions about boosters. That's entirely inappropriate. This is exactly what people didn't want when Donald Trump was in office. Now they're very happy to have it. And that is a huge double standard. And the reason there's a double standard is, of course, most academics
are climbing once again, with hospitalizations also up across the region. Experts say the newest variant is driving the increase.
CBS 13's Tori Apodaca is here with what we're seeing locally. Tori?
Yeah, that new variant, JN1, may be more contagious, but the good news, it's less severe. Still, it's something health experts say we need to keep our eye on and do our part to stop its spread.
Spending the holidays isolating from family.
I couldn't celebrate with my family.
Deciding to test when she got a runny nose and cough that wouldn't go away. Placer County Interim Health Officer Dr. Rob Oldham tells CBS 13 it might be a good idea to start masking up when indoors in public, to stay up to date on vaccines, and to bring as much fresh air into your home as possible during gatherings.
COVID is going to be with us for the foreseeable future. That does not mean it has to dominate or rule our lives if we take sensible precautions.
So as we finish out the year, flu cases are also rising. So how can you tell if you have COVID or the flu? Doctors say the only way to know is by testing.
This morning, Bay State Health is updating its masking policy due to the steady increase of COVID-19 cases, both among the community and in patients. Masking will now be required at its hospitals. All visitors over the age of 5 will be required to wear masks at all Bay State hospitals and the DeArmor Center for Cancer Care. Officials say community testing and wastewater surveillance data point to the increase in COVID-19 cases, and they expect the trend to continue.
COVID variant is now driving nearly half of all COVID infections, according to the CDC.
Tia's talking about JN1. It's prompted some major health systems across the nation to bring back mask mandates.
The trio of respiratory illnesses are spiking statewide and locally at the end of the year, just ahead of the new year, where these illnesses typically peak. WDHN's Robert Smith has the story.
Respiratory season, the end of the year, COVID-19, RSV, and influenza are spiking at the same time. Flu being the most pertinent. A map from the CDC shows Alabama in a purple color, which means very high.
Going to an LA County hospital is now required to wear a mask. That includes healthcare workers, patients, and visitors. The new rule went into effect today. The health department says there's been an increase in people admitted to hospitals with COVID. The mask rule will remain in effect until the rate of hospitalizations goes down. Now, the LA County Department of Public Health tells Fox 11 that the county is experiencing 10.5 hospitalizations per 100,000.
Channel. Only 3% of Americans have gotten the new COVID-19 booster, which is a stinging indictment of this US FDA and the CDC Director Mandy Cohen. They're not doing a good job, and Americans know better than to participate in their annual COVID experiment, really, because they don't have randomized data. So let's talk about this. Why is the uptake so poor? Why did they fail the American people? I think they bit off more than they could chew. So this CDC director came forward with a recommendation that was absolutely bonkers, not in line with the rest of the world, which is that anyone 6 months and up should get the COVID-19 booster this fall. It didn't matter if you had COVID before. It didn't matter if you had COVID 3 times before. It doesn't matter how many doses you've gotten before. You need the fall booster. They literally pulled that directly from their ass. There's no evidence that that would be the case. And in fact, it really defies common sense and logic to think. Just imagine a 20-year-old man who's had 3 doses and he's had COVID twice. You really think that he's going to get a further reduction in severe disease, hospitalization, and death from getting this annual booster? You really think that that's possible? His absolute risk of bad outcomes going forward are floored. They're literally as low as they can come. We don't even have reliable statistics because we don't even see ARDS from COVID-19 that often anymore. We have a statistic called hospitalization from COVID-19, but that often includes incidental hospitalization. In other words, you came in with a broken leg and we swabbed your nose, you happen to have COVID-19. Doesn't mean it's COVID-19 that sent you to the hospital. So we don't even know the absolute risks for such a young man. It's going to be super, super low because they've had him recover from COVID-19 a couple times. They've had a couple shots in the past. And they're telling you that the shot will make you better off. They have just no evidence for that. It doesn't even make sense. It's extremely unlikely. And European governments don't agree with them. I mean, we have Australia, we have Sweden, we have the United Kingdom. Nobody is aggressively pursuing vaccination in people of all ages above 6 months and up, irrespective of health conditions. No one is aggressively pushing this vaccination in a 20-year-old man who is healthy and had COVID twice. No one is doing that except this CDC director. Do not report COVID-19 cases to schools. Do not test yourself or your kids if you're ill. This came out on my Substack. It's incredibly popular, and it's in response to crazy public health measures. So let's get into it. This all got started because Montgomery County, good old MoCo, just outside of DC, and actually the county where I once lived in, has re-implemented an N95 mask mandate for kids because of COVID-19 and other respiratory concerns. Well. That's a pretty boneheaded decision by public health. Let's unpack that a little bit. 1, what does it mean to have an N95 mask for kids? It actually is a meaningless statement because to claim that a mask has filtration properties of N95, you have to do certain types of accreditation studies which have never been done on children, okay? So you don't know it's an N95 mask for kids. That's number 1. Number 2, we do know community mask recommendations have no evidence that they improve outcomes during this pandemic, and the randomized evidence from Cochrane shows that they just don't work, as Tom Jefferson himself said. Okay, so the mask recommendation doesn't work. That's in adults. What do we know about in children? In children, we know even little because there are very few randomized studies in children. I don't think there are any randomized studies in children. There are regression discontinuity studies from Spain that show masking doesn't work in kids. And then the other thing we know is that 96% of kids have already had COVID-19. That's per the CDC's own guidance. So you have to be dropped on your head to think that kids should continue to mask in the future.